Hi, welcome back to my channel. My name is Carissa, and March is Multiple Sclerosis Awareness Month, and I wanted to discuss my story with multiple sclerosis and my diagnosis. So what is multiple sclerosis? Multiple sclerosis is a chronic autoimmune disease of the central nervous system where the immune system damages the protective myelin sheath that covers the nerve fibers in the brain and the spinal cord. They're not for sure what causes it, but they think being exposed to the Epstein-Barr virus could be a possible link. Mostly white populations, northern white populations, are diagnosed, with the majority of them being women. So to tell my story, we have to go back to the 90s. And as a teenager, I was taken to Maquoketa Park to go on a day date, and I experienced, some symptoms similar to heat exhaustion. It was a very hot day, and I got sick. I didn't feel well. I was super hot. I got fatigued and probably ruined the date, but that's how it went. The rest of my teenage years, I experienced fatigue, depression, anxiety, which are, teenagers get fatigued, teenagers get sad. So I didn't think a whole lot of it. I also had pretty horrible stomach issues. That was probably my main concern. I had been on lots of medication for different stomach things. I had been misdiagnosed a couple times and was taking medicine for stomach ulcers, but they were kind of just making my stomach just feel worse. So I decided I just didn't want to take it anymore, and so that was that. By my 20s, by the time I had my kids, my fatigue was crazy. I still experience depression I've had that since I was a kid. I was sleeping all the time. I couldn't stay awake. My duties as a mom were being affected. And I asked my doctor, I said, I'm feeling pretty poorly. I think we need to take care of this. And so he ran some tests on me. I think the tests were like for cancer, for diabetes, and I came back fine. And he said, maybe drink more coffee. So I had never drank coffee before, and I thought, well, if this is what everybody else is doing, then maybe that's the ticket. I just didn't understand how, if everyone in the world felt like me, how exactly was the world still turning? But I ended up liking coffee and became addicted to coffee, so I carried on. By my mid-30s, I was again, it was a very hot day, and I was mowing the yard, and I had been drinking dandelion tea for some hippie reason, and I thought I was having an allergy attack. So my eyesight was similar to when you're in the sun and you come inside and it takes a while for your eyes to adjust. My pupils were different sizes. My right one was really small, and it seemed like my left one was really big, which was probably normal size, but at the time it seemed like it was really big. I lost my smell. Half of my tongue had no feeling in it, and that side had also no taste. And I probably could have got a diagnosis then, but I have really bad imposter syndrome, and it had so many bad experiences with doctors, and it kind of just learned to just let it go. You're weird. You're making stuff up. Like, just let it go. And so I dismissed it all. It went away. It took about a month to go away. I know. I should have was ridiculous that I didn't go to the hospital. So I'm in my late 30s. I'm experiencing fatigue really bad again. My stomach issues were intolerable. I was having an out-of-body experiences where, my body's here, but I felt like I was floating above myself. My arm would sometimes, do weird things for like a second, and I dismissed it because it would only happen for like a second. And I was like, you're weird. It was so subtle that I just once again dismissed it. January 26th came around, or January 2016 came around, and at the top of the year, I had told my husband, I really don't think I'm doing well, Paul, and I'm not sure I'm going to live the year out. And he said, that is crazy. You need to go to the hospital. And of course I didn't and wouldn't. And for the rest of the year, I experienced fatigue, really bad stomach problems, and I'd lost a significant amount of weight at that point. So the night of October 31st, 2016, I had told my husband, I'm like, I think I need to go to the emergency room. I think I'm experiencing appendicitis symptoms. So we went to the emergency room, and I had x-rays done, and I apparently had the largest appendix that the ER doctor had ever seen. And there was a cyst inside of it. So I was admitted to the hospital and scheduled for surgery the next day. So the next day I had a hemicolectomy. They removed my appendix and part of my colon, and I didn't feel, I was told that everything would go away and I'd be fine afterwards, but they removed the cancer and everything went fine then, but I was still like really tired, and I was hoping that, that would go away. I thought, oh, well, this was, the symptoms I had just been experiencing had to have been the cancer that was in my body. But my stomach was feeling a little better. However, I overall just did not feel better. I went in for more tests. I was diagnosed with hyperparathyroidism, which, if you know what that is, it's a disease that mainly people in their 70s are diagnosed with. It's not very often people of younger age do, but hyperparathyroidism is it's when your parathyroid is overactive. It causes high calcium in the blood. It also causes low vitamin D, and my vitamin D levels were probably at an 11 when I think the normal level is 20 to 50. And so I had my parathyroid removed, and now I'm in my late 40s, and it's 2023. I had again told my husband, I don't think I'm doing well, and I'm worried that I might not survive the rest of the year. And, if you have ever had true fatigue, you'll know that you just feel like you're dying. Like, you don't feel well at all. So my fatigue was bad again. My cognition began bothering me worse than usual. I couldn't remember things I was supposed to do. I couldn't cook two things at once. My multitasking had become an issue. I would forget to turn off the stove. I still forget to turn off the stove. I began dropping things. My fingers had a harder time holding items. My balance was an issue. I would be standing and just fall over. I would usually catch myself in the house, but if I were to go outside, I knew without a doubt I would fall down on the ground. Heat would make me sick. every time I'd go tanning, it was blind. It would take a lot longer time for me to recover from it. Like it's just black for a while. My fingers were numb. I had buzzing in my lower extremities, and my feet. And of course, I had this, I call it glitching, but it's Lermet syndrome, I believe it's called. And it's where you get like electric shocks in your body. They don't really hurt. They kind of tickle me. But I was also experiencing vertigo, where every time I would stand up, the room was spinning and I would pretty much fall down. So, my husband, who hadn't worked on the road for a very long time, had decided, he needed to go to a job site. And the day before he left, I went to the hospital to get a corticosteroid for my lungs. I know, I have a lot of issues. But I went and got a corticosteroid, and you would have thought that would have actually prevented what was about to happen. So my husband went on the road, and he left for a few days, and I was having a good time, hanging out with the dogs. And so the next night when I went to bed, I woke up at probably 3 or 4 in the morning. And the day before, I also was having really blurry eye symptoms, like I attribute it to allergies, because it's kind of like, it was like when you have allergies and your eyes are really watery. So that was going on. But anyway, the next night I went to bed and I woke up at probably 3, 4 o'clock in the morning, and I thought, I think I'm paralyzed. But I went back to bed because I wasn't quite awake. It was like 3 or 4 in the morning. So I went back to bed and then woke up again at daylight. It was about 7 o'clock, and I laid there for a minute, and I was like, oh my gosh, I think I can't move my left side. I really can't. So I had to go to the bathroom like most people do in the morning. So I thought about it for a minute, and then I took my right side of my body and had to physically move myself to the side of the bed. And I sat up and I counted to 3 and then stood up and grabbed the wall and proceeded to go through the living room, where I'm glad there was furniture to hold on to, because I kept wanting to do headers like into the furniture, as I'm walking through on the left, to the left of me. So I made it to the bathroom. I got my business done. I stood up and I collapsed. And let me tell you, it was the craziest, like, I've never had to work so hard to pull myself up off the ground. I used, pushed with all my might, finally stood up, grabbed a hold of the wall, and then proceeded to make my way back to the bedroom. I then fell asleep. I was dead tired. I then fell back asleep and didn't wake up until probably 10:30 in the morning. And I woke up 10:30 in the morning, and I thought, oh my gosh, that really happened. So at this point, I should have called an ambulance. And how do you know I'm Gen X without telling you I'm Gen X? I will literally probably die before I go to the hospital. So I thought, my husband's going to be home tonight. He'll come home and he'll take care of everything. So I waited that night. He came home. I was like, Paul, told him what's going on. I was like, I don't know what to do. And he was like, you're crazy. So he took me to the hospital the next day. And I'm thinking, first of all, I'm thinking I've broken myself, and I've ruined ever being able to stay home alone again. But he took me to the hospital the next day. They ordered me MRIs. I had MRIs done, and that night, my doctor, Dr. Patton, called and said, well, there's 3 things possible. 1, you have a tumor. 2, you've had a stroke. Or 3, you have multiple sclerosis. And he said, I don't think it's, the first 2. He's like, I'm pretty sure that you have multiple sclerosis. And then he proceeded to lecture me, which I totally deserved. And he said, if this ever happens to you again, you absolutely have to get to the hospital, because, if not, we might not be able to do anything for you, and you could be, crippled. So, got my lecture, and then we scheduled me a neurologist appointment, and that probably took about a month to get into. Meanwhile, during that time, I'm rewiring my brain to learn how to walk straight and talk straight and use my hands properly. And finally, I got to the neurologist, and he said, you definitely have multiple sclerosis. There's over 20 lesions on your brain, which shows, how long you've probably lived with this, and that it was a very aggressive form, and he diagnosed me with relapsing remitting multiple sclerosis, RRMS. And we talked about my symptoms. We talked about getting treatment, and I didn't want to be the one to choose what my treatment was. I left that up to my husband, because I thought, I hate taking medicine anyway. Go figure, because I don't like to go to the doctor or anything. So I left that decision up to him. I was given a few options. One was Kesimpta, I think. There was a second one, which I don't remember what that was. But the third was Ocrevus. And Ocrevus is what my husband chose. His main goal was to get me back to walking. He didn't want, he just didn't want things to be, like done here. We're used to kayaking every summer and hiking, and, that was really important to him to get back to, that kind of lifestyle. So that's it. I've done three infusions so far. I'll be going for my 4th infusion next month in April. I'll take the camera along with me then. We'll be doing, I don't know what we'll do. I'll just show you like what's going on, and I'll probably do another video of, what my symptoms are still and how that affects me. Sometimes I use a cane. I don't use a cane very often, but when I'm feeling weak and fatigued, I do get out the cane, so just so I don't, fall over and look like an idiot. But that's it. So if you have any questions, go ahead and ask. Sometimes I ramble on and don't make, I don't sound too coherent. So if I confused you any, please don't hesitate to ask questions. Thank you for watching my video, and I hope you have a lovely day. Bye.